Riverside Healthcare puts the health and wellness information you need well within reach.
This is the Well Within Reach podcast, and I'm Alyssa Diaz. Joining us today is Dr. Brian Ruiz de Luzuriaga. Dr. Brian, thank you for joining us. And today we're going to be talking about Riverside's Comprehensive Breast Center and Breast Imaging Center in particular. But first, let's talk about your role as a radiologist. And first, give us a little bit of a background on your training and how you got to Riverside.
Sure. So thank you for having me today. So I've been a radiologist since 2009. I completed my residency at Northeastern Ohio University College of Medicine in Ohio. Went on to do fellowship at Duke University for musculoskeletal imaging, and then I've been practicing in the Chicagoland area since 2010. I was able to join the staff here at Riverside Medical Center back in 2016, and have been working closely in the breast center along with our other colleague, Dr. Ravi Ramakrishna. So it's been my great pleasure to be here serving the patients at Riverside.
That's great. Well, let's jump right into our topic of Riverside's Comprehensive Breast Center. And I found this statistic, it's quite staggering. 1 in 8 women will develop breast cancer in her lifetime. So that's pretty shocking, as a female to hear and really grasp that statistic. But we do know with increased awareness, early detection, and innovative new treatments that survival rates continue to rise. And also at Riverside Healthcare, we're committed to providing high quality, compassionate breast care. So anything from advanced imaging, as we'll focus on today, to a full range of treatment options and support services, you'll find everything you need to take charge of your breast health. And so to begin with, focusing on breast imaging in your specialty, what are the recommendations for annual mammograms for women?
So the recommendation that we use as radiologists, as part of the American College of Radiology, along with other organizations like American Cancer Society and American College of Surgeons, do recommend annual screening mammography at age 40. Screening mammography is the only test that's been scientifically shown to decrease risk of death from breast cancer. And if you look at large randomized controlled trials that were performed from the 60s into the 90s, they show a reduction of your risk of death from breast cancer to 0.8. So if you have a risk of 1, that's the same as average. So we're actually cutting that down through these screening programs. And today, just on my way in, I heard about a new article published in the journal Cancer that talked about the importance of screening programs along with the current treatment modalities that are utilized from the early 90s to now. They estimate around 500,000 women's lives have been saved due to these screening programs and the treatment regimens. So it really has made quite a huge difference for patients' lives.
That's quite incredible. And we talked about, okay, so a comprehensive breast center, that's anything from surgery to imaging to, oncology, even support services, things like that. But more specifically for your specialty as a breast imaging center, what does that mean to be a comprehensive imaging center?
So here at Riverside, we're very pleased to be able to offer a full range of breast imaging services in our pavilion offices. So women will come in. Many of them have their screening mammograms done here on campus. There's also several off-site campuses that we have where they can come in for their screening mammograms as well. In addition to those, at the Breast Imaging Center, we'll also provide the next step of diagnostic tests, including diagnostic mammograms, which are mammograms that can be done, for example, when a woman comes in with a new complaint, say having found a new lump in their breast. Other times we'll be doing the diagnostic mammograms after we found an abnormality from that first screening mammogram. Or we may be following up women who have had, for example, recent surgery for breast cancer or for some other benign growth that we had discovered. Beyond mammography, we also provide breast ultrasound services, which again may help for workups for new lumps. We can also offer them for whole breast screening ultrasound in the setting of dense breasts. Finally, the other main modality that we have here at our breast center is breast MRI, which is something typically we offer to women who may have already been diagnosed with breast cancer to help surgical planning or to looking for disease in other sites of the breast, or to help screen for breast cancer in women who've been found to have a high lifetime risk for breast cancer. Beyond the imaging tests, we also do we'll do actual image-guided biopsy procedures to help the surgeons and oncologists with the actual diagnosis of breast cancer. So we can do those procedures under imaging guidance using ultrasound or mammography to help target tumors for tissue sampling.
Right. And that means, Riverside provides support every step of the way. So aside from all of the imaging services, tell us about some of the support services and those staff members that help patients along this journey. They have all of these imaging modalities performed, then what?
Right. So certainly there's our full range of staff of imaging technologists in mammography and ultrasound and MRI who are very critical to the whole process. Also here at Riverside, we're very fortunate to have our own breast care and cancer navigator, Allison Heil. And she helps patients to navigate the whole stage from the diagnosis, navigating through the imaging center and then getting the patients connected to cancer care, to surgery. She also will work with the provider offices, for example, the OBGYN offices, to help get patients through the screening process and treatment process.
And, meeting Alice and myself, she does a fantastic job of making sure that patients are understanding the entire process. She's there to help answer questions and really to help connect the dots because some of these things are completely new to the patients that are experiencing all of these imaging modalities. And Allison really helps patients to understand what all of this testing means and what maybe their next step or the path that the patient needs to take means for them.
That's absolutely right. I mean, she really provides that frontline contact, the face for our section, and any questions that a patient may have in terms of getting to that next step to the cancer care, to surgery. She can help those patients get through. So she's really very critical.
And the Breast Imaging Center also has a great support staff from the techs to the greeters at the front desk. Really, it's a comprehensive center, truly, because patients are given that full range of services from the minute they walk in the door.
Absolutely. And then another very critical individual that we have in our breast center is Julie Sealing, who is our surveillance and risk assessment nurse practitioner. And so another thing that we're able to offer here at Riverside is to assess risk levels for patients who might have a familial or genetic predisposition to breast cancer. So we're able to kind of do a family history evaluation, and then we can determine if for example, genetic testing may be necessary for the patient or be valuable. And then Julie can help direct patients to, getting to genetic counseling. She can provide education, and basically she's a great resource for us being able to identify those women who are at higher risk than the average woman for breast cancer, so that we can provide, better monitoring to try and detect breast cancer early.
And Julie also helps, if I'm understanding correctly, to help patients understand other genetic mutations in their genes that might have to do with other cancers. So it really is a full look at what your genetic health can tell you.
That's absolutely right. I mean, and that's one of the great things by, you know, screening mammography may be kind of the first access point that a lot of women may have into the healthcare system, and by taking these other components of the family history and doing some of these genetic tests, you may find out additional health concerns that other forms of cancer that may be important to you individually.
Yeah, knowledge is definitely key. And as part of the Breast Imaging Center, how does that relate back to the importance of Riverside's full continuum of care for patients along their breast health journey?
So, I mean, yeah, really, it's an extremely critical component. Screening mammography is, as I was saying in the beginning, is just such a huge component to being able to detect breast cancers early, to being able to give women the most treatment options available, including breast conservation surgery, and just continuing to be able to monitor patients who have had breast cancer in their aftercare, and continue to monitor them for any signs of recurrence. So it's really indispensable to a comprehensive cancer center, and breast cancer in particular.
And it's just helping patients along every step of the way. There's resources every step of the way. And I think you did a great job of helping us to understand what the Comprehensive Imaging Center portion of that bigger picture means. And how might individuals seek more information about Riverside's Breast Imaging Center?
So probably the best resources is to go online at riversidehealthcare.org, and you could find out more about our services.
All right. Thank you for joining us. And that wraps up this Well Within Reach podcast.